Doctors in the U.S. are eyeing a new acquisition by Weight Watchers with increasing concern. The company is buying a telehealth subscription service for prescribing weight loss and diabetes drugs. That, in turn, could increase access to a popular drug that claims to do both, called Ozempic. A CBC News investigation earlier this year looked into Ozempic's marketing claims it can be used to lose weight. It revealed there is evidence the drug can help with weight loss when combined with exercise and healthy eating habits. However, doctors note the weight only stays off with continued use of the drug, and they fear the drug's increasing popularity could reduce access for people who need it exclusively to treat diabetes. For more on this, we are joined by Canada Tonight's medical contributor, Dr. Samir Gupta. He's in Toronto. And Dr. Gupta, folks are talking about this drug. It's evidenced by all the hits you're getting about it on your social media. It was initially approved to treat diabetes, but what does Ozempic actually do exactly?
Yeah, Dwight, so it's really interesting. As you said, it has an impact on diabetes, and that's what it was designed for. It increases insulin levels, it reduces sugar. But what they found in those trials is that people who were taking it for diabetes also lost weight. And then they did these trials, and there have been many, many trials looking at this in non-diabetics as an effective drug for weight loss. And it mimics the effect of a molecule called GLP-1, or glucagon-like peptide 1, that we make naturally in our bodies. In fact, our intestines make that molecule when we eat food. And what that molecule does is it signals back to the brain that, hey, you've just eaten, so you're full. So it gives you that feeling that reduces your appetite because you've just eaten. And it also slows down the movement of that food through your gut so that it makes you feel full for longer. And if you're not as hungry because your appetite's down and you feel more full, you will eat less, and so less calories in. And ultimately, that's how they lose weight.
We're hearing this thing is sweeping Hollywood, some stars using it. And as we mentioned, a lot of people who don't need it are getting their hands on it for this weight loss. So how are they managing to do that if it's a prescription drug?
Yeah, I mean, I think it's debatable, whether they don't need it. People who are overweight and obese, many would argue, have a serious health condition, and they need it for that as well. And so, I mean, this is where the conversations are happening, Dwight. And right now, it's the same molecule called semaglutide has been approved both for diabetes and for weight loss at different doses. And unfortunately, what's happened is that provincial plans and private insurers, for the most part, are not yet covering the version that's for weight loss. So what's happening is a lot of people are going to their doctors and saying, I really need to lose weight. Can you prescribe for me the diabetes version, which is the same molecule, and that's called off-label prescribing, but it will be covered then by most health plans, private or provincial, so they get their hands on it that way. And we know this is happening because there was a study in Ontario suggesting that 20% of people on Ozempic, which is the diabetes version of it, don't have diabetes. So they're clearly taking it for weight loss. So this is how people are getting it.
Dr. Gupta, are there dangers or side effects of using a drug like this if you don't need it?
Yeah, like for any drug, there are side effects, and particularly it's gastrointestinal stuff like nausea, vomiting, constipation, diarrhea. In a small percentage of people, there are more serious side effects, and that's why this drug, like any other, requires follow-up. It requires, it's not something you should just be ordering off the internet to lose weight. It's something you should be doing in conjunction with your doctor and with monitoring. But whether you're diabetic, you're using it for that, or for weight loss, or both, it's something that has been shown to be very effective.
I mean, I feel like I'm seeing a lot of commercials for this particular Ozempic drug. What have been then the negative impacts of its current popularity?
Yeah, I mean, I think the main thing is the concern, as you started with, that people who are using it, and it's been around for diabetes for many years. People might have been on it for over a decade for their diabetes, and all of a sudden there's so much demand for it that the company can't keep up with production. So people who are diabetic are not able to get this go-to medication that they've been on for so many years to control their sugars. And that's a concern because there are other options, but once you're on a certain regimen and you've controlled your sugars, it's best to continue with that regimen, and they are having trouble getting it. And that's where these conversations are happening. People with obesity are saying, I have a chronic disease too. And we're sort of seeing a shift in how people talk about and think about obesity from a lifestyle choice or a moral failing to, no, this is a chronic condition. This is a complex chronic condition. And once we acknowledge that, we can start thinking about preventing it and treating it how we do other conditions.
Yeah, I'm sure a lot of us didn't think about that particular point until you brought it up tonight. That was Canada Tonight's medical contributor, Dr. Samir Gupta, joining us from Toronto. Thank you, Dr. Gupta.